Welcome to the UC Health Improvement Academy. Today we will talk about a powerful tool that is needed for the understanding phase. Imagine yourself on a beautiful Sunday morning, getting started with a perfect cup of coffee. But then, ouch! It's the darn Lego piece again. This is the third time it happened this week, and this time you also spilled your coffee. It's time to take action. No more Lego for 2 weeks. They need to clean up properly, and that's gonna teach them a lesson. This may feel good, and in your head you're fixing a recurring problem. But what if this is not the right intervention for the problem at hand? What if the cause of the problem is different? Let's think about it. Many times we may jump to actions without an understanding of the problem. In this case, what if it's not the kid's fault? Rather, it's your cat. Or maybe it's the carpet design that makes it hard to see small pieces. Or maybe your child needs a new pair of glasses. Now let's take this to a bigger level of complex systems that we all work in. A medication error, a near miss, an avoidable infection, a delayed intervention, and other problems we may see in complex healthcare systems. What are the consequences of making a rash decision or wrong judgment in this setting without proper understanding? For one, such a change or intervention wouldn't get rid of the problem. It will for sure cause you more frustration and demoralize the people that make up that system. You might have been affected by such decisions made by someone or done that yourself. So how can we understand the problem better? One simple and very effective way is to go to the site where action happens and observe the process in real time. See it yourself. This is what we call go see. You and your team is out there in the field to learn. Ask to understand, and observe by putting aside your preconceived assumptions and biases. You may find failures you never anticipated, workarounds that people use every day, good and bad variations, bright spots, new ideas, and much more. Be ready for many aha moments. Oftentimes, teams find that the problem is worse than what we thought it was, more complex than we ever imagined, or much different than we thought it was. By observing the process as it occurs in real time, we get past our initial assumptions about what is supposed to happen and see instead what actually happens. Try to spend time at all stages of the process. Observe it at different times of the day and different days of the week. Observe the work happening. Ask questions from people doing the work. Engage the end users of the process to see how things look from their end. And most importantly, capture your learnings. Let's take an example. You are observing how home medications are provided to patients at time of discharge. Our Go See template provides a guide for documenting your learning. Depending on the process and environment, you may focus on a particular aspect of observations more than the other, but keep your eyes and mind open. Here you may learn the steps involved in the process, who does what and how much time each step takes, the interactions between people, technology, and their equipment, opportunities for errors or failures, reasons for failures and their frequency, reliability of the process, or workarounds. Ask clarifying and exploratory questions from the people involved. For example, how does the process work? What do you do if something is not working? How often you encounter this problem? What do you think is the cause of this? And so on. Remember, don't assume, rather ask. Focus on the process rather than people. You may also learn from variations. When and how is the process done well, and when and how it is done poorly. All this information will enable your team to design the right change your system needs for improvement. And you may need to do this activity more than once and at different intervals throughout the change journey. Go See activity is essential for using other tools used in the understanding phase of the UC Health process improvement way. With this information, you can build or refine your high-level process map, you can populate your simplified failure mode effects analysis, and build meaningful Pareto charts for failures. Now it's your turn. Get out in the action field and understand before you make any decisions, because no one wants to step on that darn Lego piece again.